Good morning. Today's topic is lateral incisor. As we all know, we have 8 incisors in number. There are 4 in maxilla and 4 in mandible. The incisors which is helping to cut the food. And the lateral incisor are the smaller form of central incisor in its function as well as its form. This is nothing but the smaller form of the central incisor. The maxillary lateral incisors supplement the central incisor in its function because the crowns bear a close resemblance. That is, the central incisor is the supplemental tooth to lateral incisor. That is, they lateral incisor bearing close resemblance with the central incisor. Lateral incisors are nothing but the same tooth as that of central incisors, but having smaller dimension. But the lateral incisors also have the same function, that is tearing of food. Lateral incisors small in dimension, but in exception in the root length. When we are comparing with the lateral and central and the proportionality between the crown length and root length, we can see that the root length of lateral incisor is somewhat larger than that of the central. Here is the picture of the 5 aspects of the lateral incisor. The first picture showing the labial aspects, the second one is the lingual aspect, and the third mesial and the distal, and the last one is the incisal aspect. We can see that these aspects are similar to that of the central incisor, except that the size is somewhat smaller, and we can see that the central incisors showing somewhat straight line like appearance, but in case of lateral, which is more rounded. Here is the labial aspect. Here we can see that the mesial outline is more curved, and here also distal is also curved when we are comparing with the centrals. Hence, we can say that the lateral incisors are same as that of central incisors, except in the size as well as in the roundness. Here it is more rounded. When we are talking about lateral incisors, we can see that anomaly is common. That is, it vary in form more than any other tooth in the mouth except the third molar. Third molar also showing variations in shape, but lateral incisor is the most commonly affected in developmental anomalies. Like they may be appears in various forms like conical shape and tubercle shape, and the most common anomalies associated with lateral incisor is the peg-shaped laterals. Here is the picture showing the peg-shaped laterals, that is screwdriver-shaped lateral incisors. This is the labial aspect. Here, the maxillary lateral incisors appear to favor that of the central incisors, which means labial aspect is somewhat similar for central as well as lateral. Usually, it has more curvature with a rounded incisal ridge and rounded incisal angles mesially and distally. In case of lateral incisors, it has more curvature and having rounded incisal ridge, rounded incisal angle when we are comparing with the central. Central is having somewhat straight outline and straight incisal ridge, but in case of lateral, it is more rounded. Although the crown is smaller in all dimensions, its proportions usually correspond to those of the central incisors. Here we can say that the crown is smaller in all dimensions, but when we are considering with the central incisor, they are smaller but having the same form of central incisor. This is the picture showing labial aspect. Here we can see that the curvature is more for distal aspect than that of mesial aspect, and the mesial and distal is somewhat rounded when we are comparing with the centrals. And crown length and root length when we are comparing, and the proportionality of the root length is somewhat larger and longer than that of the centrals. This is the labial aspect, and the mesial outline of the crown from the labial aspect is resembled to that of central incisors, but the difference is only in the roundness of the mesio-incisal angle. The crest of contour is usually at the point of junction between middle and incisal third. The crest of contour or the contact area of the mesial aspect is at the junction of middle and incisal third. In case of distal outline, which is more rounded, and the crest of contour is more cervical, and some forms describe a semicircular outline distally from the cervix to the center of the incisal ridge. That is, when we are comparing the distal aspect of the lateral incisor, which is more rounded and having an appearance of semicircular appearance, which is starting from the incisal ridge towards the cervix. This tooth is relatively narrow mesiodistally, and it is about 2 mm narrow than that of central incisors. And the crown on the average measures from 2 to 3 mm shorter cervico-incisally than that of central incisor, although the root is usually long. The root tapers evenly from the cervical lines, point approximately 2/3 of its length apically. Here, the root tapers evenly from the cervical line, approximately 2/3 of the length apically. In most cases, it curves sharply from the location in a distal direction and ends in a pointed apex. Although the curvature distally is typical, some roots are straight and some may be found curving mesially. The curvature of root is towards the distal side. That is, all root will have a tendency to incline towards the distal side, but in some cases they may be straight or they may be found curving towards the mesial side. The tooth may show considerable variations in its crown form. The root form may be more characteristics. That is, this is the characteristic feature of lateral incisors, that is, which is point towards the apical. That is, there is no bluntness. It is pointing towards the apical direction, and the crown length is more when we are comparing with the crown. The next is the lingual aspect. Mesial and distal marginal ridges are marked. This is the feature of lateral incisors, that is the mesial and marginal ridges. Mesial and distal marginal ridges are well marked and they are converging each other, and you have a cingulum which is prominent at the center of these two ridges at the cervical portion. Within the center of the cervical portion, you have the cingulum and having deep developmental grooves within the lingual fossa. The lingo-incisal ridge is well developed and the lingual fossa is more concave. The tooth tapers towards the lingual and resembling is central in this aspect. Here we can see that these distal marginal ridge and the mesial marginal ridges are converging, and you will get a cingulum at the center of the cervix, and you have a very deep concave lingual fossa Some common findings to the lateral incisor is there is a deep developmental groove at the side of the cingulum, usually on the distal side. Here you can see this grooves, which is presenting at the distal side of the lateral incisors, distal side of the cingulum. There is a deep developmental groove, which is known as palatogingival groove. Next is the mesial aspect. Here, the mesial aspect of the maxillary lateral incisor is similar to that of small central incisor, except that the root appears longer. The curvature of cervical line is marked at the direction of incisal ridge, and because of its small size, this curvature is not so pronounced. The root appears as tapered cone from this aspect and having blunt around apical end. Next is the distal aspect. Here, the crown distally appears thicker than in the mesial aspect, and the curvature of cervical line is usually a millimeter or less than that of mesial side. The common thing is the developmental groove, which is seen distally on the crown and extending on the root part of the root part of the tooth. Here, there is a developmental groove which is uh, appearing from the crown and extending towards the root. This is the distal aspect and showing the developmental groove is extending towards the root. Next is the incisal aspect. The incisal aspect of this tooth sometimes resembles that of the central incisor, and it may resemble that of small canine. The cingulum may be large, and the labiolingual dimension may be greater than that of mesodistal. All maxillary lateral incisors exhibit more convexity labially and lingually from the incisal aspect than that of centrals. This is the incisal aspect. And when we are considering the chronology and the measurements regarding maxillary lateral incisor, the first evidence of classification is at the age of 10 to 12 months. Then enamel is completed at 4 to 5 years, eruption during 8 to 9 years, and the root completed 11 years. The dimensions of the lateral incisor, the crown length is 9, the root length is 13, mesodistal diameter at crown is 6.5, at cervix is 5, and the labiolingual or buccolingual dimension is 6 at the crown and 5 at cervix. Curvature is 2 to 3 mm less than that of the centrals. Thank you.